ITV wishes to advise that this program may contain images of people who have passed.
Tonight, a special living black from the township of Wilcannia, struggling to cope with the COVID outbreak. We came here to talk to the people and hear their stories.
Help her tonight.
What we found were harrowing tales of suffering and the failure of governments to protect the people on the banks of the Barker River.
At the start, I think, to my belief, it was damage control. They didn't take this COVID seriously.
Right now, emotionally, there's still a lot of confusion, a lot of anger.
They were just sitting back, waiting for the virus to get here and then want to jump up and down and try and do something about it.
I'm standing on the Barrier Highway where, only a week ago, a family of 2 adults and 2 children, all diagnosed COVID positive, were forced to walk out here to a medical isolation camp. We've been told New South Wales Health and the police refused to transport the family, leaving them to fend for themselves, carrying their luggage, their daughter an asthmatic, scared, angry and humiliated.
They could at least give us a ride, like that's what they're supposed to do, wasn't they? They're supposed to help us out for transport and all that there, especially when we needed them the most, and yeah, they never give us no help whatsoever when we needed them to help us.
That failure to help people became clear when the local supermarket closed.
That meat is fresh now, and it's our duty.
Brendan Adams, a local radio broadcaster, found himself delivering wild kangaroo meat to hungry people in the town.
Ronnie, you want some meat, my brother?
Wilcannia, with a predominantly Aboriginal population, is now a town under siege, under strict lockdown, with authorities rushing to play catch-up. Here, there's strong debate about how the virus arrived and spread.
That's good meat, though.
2 weeks earlier, authorities in Sydney were quick to blame, accusing people of attending a legal funeral in the same breath as an illegal beach party in Maroubra.
There is no time now to be selfish. It's time to think of the broader community and your families. If you are actually spreading the virus, you could be responsible for people's deaths.
To speak in that sentence about a funeral is just, for us here, is just absolute disrespect. But, at the end of the day, it was just a blame game. And that's what we felt like, that they were just trying to pass the buck and blame someone for it, when in fact, at the end of the day, the government's got no one to blame but themselves.
It was more than disrespectful. That was ignorance. That was plain ignorance,
It wasn't the funeral where people contracted the virus or where it was brought out.
So how do you think the virus got into the town?
Before the lockdown came into effect, there were still a lot of people moving around, including tourists.
Whatever the source of the virus, there is one thing we can be sure of. Michael's family was the first to get it.
We received a text message on our youngest daughter, which was 2 years old. When we seen she tested positive to COVID, you could imagine what went through our heads and how we felt. But, when it comes to New South Wales, there was just nothing there. You got the text, a couple of days later you got the phone call for, they wanted to speak to you about tracing and stuff like that, and then you were just basically left to your own device. There was no support system in place, there was no offer of, mental health or, we were left wondering, like, what do we do here? Like, we got COVID, like, are we going to die? Like, how is this going to affect us? Like, is our children all right? Like, are they going to get seriously ill from it? Like, we just had that many things going through our heads. It was one of the most frightening experiences that I've ever had in my life.
Within days, Melissa, Michael's sister, came down with a serious dose of the virus.
I was home here and I wasn't feeling too well, so I rang 000 to take me, and they come and assess me here, and I wasn't breathing too good, so they took me straight to the hospital. And I went up and got out the ambulance. They took me outside the ambulance bay and they sat there and they assessed me there. She come out and one nurse come out. They said, hang on, she shouldn't be too long now. She's just getting the bed and everything ready inside for you. Shouldn't be too long.
This is where COVID-positive patient Melissa Kennedy came seeking medical help when she had trouble breathing. Typically, admission is immediate when taken to hospital by ambulance, but the hospital staff on duty that night wouldn't let her inside. Instead, she sat on a chair in the cold desert night. They didn't even offer her a blanket.
I was still trying to breathe, and I couldn't breathe, and I was cold. I don't know why she did that, but she just left me out in the cold. She just shut the door on me. I could have fell off the chair, anything. I was outside of my home, I would have been there laying. She wouldn't have found me till she come out and wanted more observations or something off me. That's the way I felt, and I just felt, I didn't feel real good at all. I just cried when I come home.
I made contact to my sister, and she was in a pretty bad way. Saying to me over the phone that she couldn't breathe and she was having trouble breathing, and I was so stressed because I was in isolation. I couldn't leave the house to go up there to her, and I was that stressed about her. Like, is this where it happens, where she stops breathing?
The issue of what you did when you tested positive in Wilcannia was clearly a major problem, even if you didn't go to the hospital.
Look how small this house is.
How many people have you got in the house?
We had 10 here.
For Ronald Murray and his family, it wasn't easy. Simply because they had come to town for sorry business and the house they stayed at was crowded.
Because we just had a loss in the family recently, like some of us travelled because, we just had a loss, and that caused a little bit of overcrowdedness in this home, but then COVID hit there, and they tell us to come and isolate all in the same household, all right, they should have been trying to split us up.
This is where your brother had to isolate in this tent.
Trying to keep infection to a minimum, Ronald set up a tent in the front yard where his brother could isolate away from the rest of the family who had all tested positive to COVID.
Like, I set up in this tent, mentally, physically and emotionally. I broke down because of what we all going through here, we can't even grieve properly, and it's just taken a effect on all of us here, because it's like we're not getting the help that we should be getting out here.
What makes this lack of help worse is that the residents saw this coming, offered an action plan and were rebuffed.
I think they ignored us because the COVID wasn't out here. The COVID issues was the city. So concentrate on the city, they forgot about us. We don't need to worry about Wilcannia. That's how I think we were ignored, because for me as a community member, I just thought, they don't care. They don't care. If you look at Wilcannia from above, you see pretty quickly that for better or for worse, it's on the main road. Anyone going east-west goes through here.
And like we sitting on the main highway. See just there? Where that car going there? That's the main highway right to Sydney, right to Adelaide. And it was pretty scary, you know, for when we seen heaps and heaps of people coming through and stop.
Wilcannia's location is great for the tourist dollar, but bad when the rest of the state gets COVID-19. Knowing this, early in 2020, the town began asking authorities to protect them. 18 months ago, there was a community meeting in this park to prepare for COVID. They agreed on prevention of outsiders coming into town, voluntary lockdowns, alternative accommodation so that people could self-isolate safely, and concerns about funerals as super-spreading events. They pushed this up to higher levels of government and got zero response. These are the documents that Monica Kerwin and Michael Kennedy, along with the rest of the town, sent to government.
We feared what was coming. You know, we actually feared this virus 12 months ago, and we really wanted an emergency action plan. We weren't telling them to cordon off our areas where Aboriginal people live. We wanted the entire community closed off, you know. We wanted our back door, front door blocked off.
Those doors were not closed in 2020, leaving the community vulnerable. Umut Agus, the CEO of the Far West Health District, argued a lockdown would not have worked.
I think it's important to also, hark back on what exactly happened this time around. The virus spread in the context of there being a lockdown in Western New South Wales. That's where it originated from. So in fact, the community there was in lockdown, but it still didn't stop somebody traveling across. And it shows that actually, you can put all the lockdowns. It only takes one individual to break the law, and you've got a massive pandemic in your hand.
With the town's plea for help in 2020 ignored, in 2021 it got even worse. Instead of locking down when COVID Delta hit, out-of-towners continued to move between states and used Wilcannia as a stopping-off point.
When states were closing down, they were driving all through Wilcannia, stopping at the only shop we've got that doesn't even have enough supplies for our town, and they were taking our resources. They were taking our food from our kids.
Being a small country town, and for us out here, we feel like the government's only concerned about two things, and that's money and votes. And, small communities like ourselves, we provide neither one of them for government, state or federal. They just wasn't really that concerned, I guess, about us out here.
Despite no official support, the community went on the front foot to protect itself. They created their own campaign to discourage tourists from stopping and infecting them with COVID.
We just put some signs, run some signs up and just try to prevent people from stopping here. Only if it's necessary, but just keep going and things. But anyways, like I said, that never worked. They kept stopping, they kept using, going to the IGA there for food, stopping for fuel and all that there. They had no mask, no gloves and nothing. I just stand there shaking my head.
The signs clearly didn't work. The boy's nana, Auntie Anne, contracted COVID and is making a slow recovery.
It was terrible. I tell you, I wouldn't wish it on my worst enemy. It was bad. And another thing that virus do, it messes with your head mentally. And it's not nice. It's not nice.
It wasn't just the town's geography that created a problem. These Barkindji people make up a strong, tight-knit community, but they carry many illnesses which often shorten their lives.
If you look at the numbers of how many chronic disease, how many people need to be already got emphysema, things like that, high blood pressure, diabetes, the list goes on of already the underlying health issues that people suffer with now today. And then, a virus in the mix.
Once the virus got into the community, what sort of support have you received from government and agencies?
None. None. Is why I had to go on social media.
You know, we've got families living on top of families. There is no proper isolation here to isolate.
Those that tested positive have, you know, and a lot of them have, and live in overcrowding, they wanted to isolate to protect the rest of the family. They should have isolated you, then came back and test the rest of the family.
Being unprepared to isolate the town, vaccination should have been made a priority. Michael Kennedy was happy to get the jab, but others weren't so sure.
There's just too much fear and too many questions people had about the vaccine, and you know, not everyone's willing to go to the hospital and sit down and talk to a doctor about it. It just doesn't work like that in our small communities, you know.
The result of all this was a population that by and large wasn't vaccinated and at high risk of infection. As the COVID outbreak gathered pace, overcrowding became an even greater issue. When it came time to isolate, New South Wales Health, with the support of police, told some people to isolate at the Warrawong Caravan Park on the outskirts of town.
The police come around and let us know that we had to come out here and isolate.
The question was, how would they get there?
We asked them about transport and all that there, and they said that they couldn't get us any transport out of here because of the police said that they wasn't doing anything and there was no other way that we could get a ride out with anyone, you know, because we just tested positive, and I don't think anyone would have given us a lift anyway if we tried because they'd have been frightened of the COVID.
Do you feel unfairly treated by the authorities out here? They made you walk all the way out here?
Yes. As we was walking out, we actually passed the police going back in, and the police, they just pulled up, asked their names, and just kept going. They seen us walking with our little kids, and yet they still kept going, and I was wild, you know, like it did upset me, it made me angry. To be honest, I felt like a lot of things were going from my mind at the time, but I didn't want to say it. So we just copped it and just walked out here. As long as I was just worried about my little family, I just made sure they was right, you know. As long as they was right, I was right.
I asked authorities why the family had been treated this way.
Yeah, look, I'm not aware of the individual circumstances of that case, but generally speaking with, you know, COVID positive patients within the town, New South Wales Health are the primary transport providers.
Carl, that's news to me. They should not have walked 5 kilometres. I mean, you know, I just can't imagine people walking with a family for that length of time, to any length of time. If that's happened again, look, I apologise.
In early September, 3 weeks after the outbreak began, the government's answer to the town's overcrowding problems came in a line. As a survivor of COVID, Auntie Anne is critical of the lack of urgency to protect her and her community.
Because you know what? We're on our own. No one's listening. Or I run around getting cabins and I run around getting, what do you call them, things?
The motorhomes are coming in.
Yeah. What?
The challenge is always going to be housing, and we certainly had planned to make housing available outside of Wilcannia. What we didn't count on was the fact that the community's desire to remain on country and having options on the country. That was the biggest learning, really. We could have, I think, consulted a lot earlier about that.
With a tent city set up for frontline workers and motorhomes for accommodation, it seems the major priority must be vaccination. The truth is, when the virus hit, the town was starting off a low base.
But we didn't know what the extent of hesitancy might be, the initial hesitancy. So the vaccine was offered. What we saw was a number did come out, but there was also a number who were afraid to come out.
Now, thanks to a campaign going door to door to give the jab, the numbers are rising.
We have one of the highest in terms of Aboriginal communities in Far West. Wilcannia, at last count, was about 56% for our Aboriginal community. So we're actually getting there. And that's in large part because most of the community have been willing.
So we can get things straight away to people that need it, and then people also calling up at the same time.
While the push to vaccinate goes on, people must be fed. Sarah Donnelly is the deputy principal at the local school. These days, she is part of the team that runs the food bank. It began with a grant from Resilience New South Wales, and after a difficult beginning, is really starting to work.
The first thing was establishing a phone that community could call, because very quickly one of the things that we knew would be a problem was how would people get what they needed. You know, I'm a Sydney girl, and so being in isolation there is a bit different when you can have goods and services, you know, delivered to your door. I'm thinking with water rather than putting it up the back of the shelf.
Perhaps the most remarkable thing about the work she and others are doing is they are all volunteers, and the money that keeps the food bank going is now all coming from donations.
It's progressed a bit now, and as you can see, we've had some amazing donations come in, which has taken the pressure off us, because it's much nicer when I receive a call from someone asking for something and I can say, yes, I can get it to you today.
The community has pulled together, police included. Now, instead of putting Aboriginal people in the back of paddy wagons, they're filling them with life-saving water. I asked the Assistant Commissioner if he's getting any pushback because of the historically bad relationship between police and First Nations.
Historically, there has been some challenges, there's no doubt about that. But it's very pleasing to see, when I say the community come together, the local police come together. We've got Australian Defence Force here as well. I think as the end of August, over 600 hampers, 300 personal care hampers delivered right through the town. The local police attend every location that's close contacts positives every day.
Back at the hospital, the decision to leave COVID patient Melissa Kennedy out in the cold drew a public apology.
No one ever told me or rang me, or I never even seen anybody, or no one apologised to me, not to face or either on phone or anything.
I haven't contacted Melissa directly. What I can tell you about that, certainly I apologise for the fact that Melissa was outside for more than an hour. That shouldn't have taken place, because I understand it was about 3 degrees at the time when Melissa was there. That is just not acceptable. And we have actually reviewed our system and made the adjustments. So that will not happen again.
So, Uma, will you be personally apologising to Melissa?
I'll be making sure that I'll be contacting her and speaking with her directly to assure her that what happened to her won't happen again to any members of the community.
Whatever happens next is anyone's guess. But there is no doubt this community had the foresight to craft its own solutions to the pandemic 18 months ago, and the authorities decided they knew better. Wilcannia now has the highest rate of COVID-positive cases per capita across the nation.
At our community, we were talking about prevention. We did not want to be where we are right now.
The community are responding amazingly well, and the result is a positive outcome. And in fact, what I'm hearing actually is that Wilcannia needs to be shown as positive about how actually community and the service can respond to an outbreak of this magnitude.
As the old saying goes, it's no good shutting the gate when the horse is bolted. And that's where we're at now. We're left chasing the horse around now, and the virus is here and it's spreading rapidly throughout our community, you know, and they haven't got control over it. I feel like they're nowhere near having control over it at the moment.
Australia has done many things right in the battle against COVID, but in so many ways, Wilcannia is a living example of how not to handle a pandemic. The town should have been isolated. It wasn't. People should have been vaccinated earlier. They weren't. Now the town is left to reap the whirlwind.